Thank you for participating in this consultation process for the Southern District Health Board Strategic Health Services Plan. I'm Tim Ward and I'm Deputy Chair of the Southern District Health Board, and this plan is vitally important to the future direction that Southern District Health Board will take. As my colleague Carol Heatley in her podcast has covered, this is a genuine consultation process. The plan itself is in draft form at the moment, but once it is adopted by the Southern District Health Board, it will become the focus and reference point for every other plan that this organisation prepares. Southern District Health Board operates over a very large area, basically half of the South Island. We know we have diverse components within our communities, within the population, and the health needs assessment, which was a research project that formed the basis of this plan, did identify some very specific issues around areas and particular health needs for some of our communities. The Strategic Health Services Plan has been prepared, as I say, from the starting point of the health needs assessment, and then we're working our way forward from there. The process, the consultation process will run until late November, and we really do encourage you to spend some time to have a look at the draft of the plan and to follow the reporting back procedures that are there. There is a huge amount of planning that does go on within our organisation. This can be from our annual plan, which we report through to the Ministry of Health and is eventually signed off by the Minister of Health. We have various workforce plans, we have financial plans, we have service plans, and we are right down to patient care level plans. Once adopted, the Southern Strategic Health Services Plan will be the guiding document for all of these other plans. So that just reinforces how vitally important it is. From a governance perspective, the adoption of this plan will also give a very clear line of sight as to how the various other plans do line up and do contribute to what the strategic objectives of what the Southern District Health Board is. If we do look at what our purpose is, at a governance level, we really do need to ensure that our communities have access to the appropriate levels of care at the appropriate time provided by the appropriate parties. Sometimes we can look a bit too narrowly as to who the provider of those services are, and what this board consultation is about is inviting the feedback from our broader community to look at what some of the suggestions have been and how in fact they may be able to be improved so that there is equitable access and availability of that top quality healthcare for our entire community. There may be some parts of the plan that does not necessarily fit comfortably with you, but we do request that you respond with what the solution is rather than what necessarily the problem may be. Again, the board is there responsible for taking a big picture view and a governance and oversight view of the operating of our District Health Board. And again, we need to ensure that the delivery of those services are consistent with what the objectives of our organisation is all about. The board is absolutely committed to the implementing of this plan. You will note that some of the component parts of the plan are already there and in place and are being delivered to our communities. From a governance level, I really do encourage you to consult amongst your friends, families, wider community, and encourage them to have a look at the draft of the plan. There is a timeline that is there in place for the feedback opportunities, and we really do encourage you to take the opportunity to be part of the solution to form the future of the healthcare services for the communities of the Southern District Health Board.